The title of this presentation is Hippotherapy by Ashley Cogshaw for Arizona State University. So, to start off, what is hippotherapy? Hippotherapy is a Greek term that is defined as physical therapy in which a patient, as one affected with cerebral palsy or multiple sclerosis, sits or lies on the back of a horse for the therapeutic effect of the horse's movement. Hippotherapy has been in practice since the 460 through 377 BC, when Hippocrates mentioned it in his chapter Natural Exercise and described it as a form of writing. Hippotherapy has many mental, physical, and emotional benefits, but it is primarily used for its physical benefits. The practice of hippotherapy is greatly utilized by those with cerebral palsy, multiple sclerosis, spinal cord injuries, and individuals who are post-stroke. Those who participate in hippotherapy experience physical benefits such as improved balance, improved stability, as well as improved posture. The physical benefits are in great part due to the gait of the horse, which mimics a human's pelvic movement. This plays a great role in an individual's recovery process. They also experience many psychological benefits, which include improved self-confidence, improved self-esteem, and improved self-motivation. An aspect of hippotherapy is therapeutic riding, also known as THR, which is also known as recreational riding. This is different from regular hippotherapy in that it focuses primarily on the emotional, cognitive, and emotional benefits, rather than the physical benefits. The therapeutic riding is used primarily among veterans, PTSD victims, and as well as at-risk children. During the therapeutic riding, the rider focuses on their motor and sensual sensory. Though it is mostly known for its psychological benefits, therapeutic riding does include physical benefits, which are improved posture, improved mobility and gait, as well as an improved balance. Liz Hartel is an important figure in the world of hippotherapy. She was born on March 14, 1921, in Hellerup, Denmark. She grew up riding horses and competing in show jumping when she was diagnosed with polio at the age of 23. She became paralyzed from the knee down, but she continued riding as a form of rehabilitation and training for the Olympics. She competed in the Scandinavian Riding Championships in 1947, and she finished second place and then represented Denmark in the 1952 Helsinki Olympics, where she won the silver medal. She became the first woman ever to ride for an Olympic team, as well as the first female medalist. She went on to compete in the 1956 Olympics in Stockholm and became a 7-time Danish national championship. She ended her career opening the first therapeutic riding center in Europe and became an influential figure for the Polio Foundation. Liz Hartel is an important figure in the world of hippotherapy. She was born on March 14, 1921, in Hellerup, Denmark. She grew up riding horses and competing in show jumping when she was diagnosed with polio at the age of 23. She became paralyzed from the knee down, but continued riding as a form of rehabilitation and training for the Olympics. She competed in the Scandinavian Riding Championships in 1947, just 3 years after her diagnosis, and finished second place. She was not able to compete in the 1948 Olympics, not because of her condition, but because women were not allowed. She was able to represent Denmark in the 1952 Helsinki Olympics, when the ban on women was lifted, and where she then won the silver medal. This is known to be one of the most emotional moments in Olympic history because Henry St. Cyr of Sweden, the gold medal winner, carried Liz from her horse to the Olympic podium. She then became the first woman to ride for an Olympic team, as well as the first female medalist. She went on to compete in the 1956 Olympics in Stockholm and became a 7-time Danish national champion. She ended her career opening the first therapeutic riding center in Europe and became an influential figure for the Polio Foundation. These are some quick facts about hippotherapy. In World War I, they used equine therapy as a form of rehabilitation for German veterans. This was not a new practice, as the ancient Greeks would offer horse rides to the chronically ill and dying as a form of coping and raising their spirits. Equine therapy did have a starting point in Switzerland before traveling around Britain and Europe and then finally making its way to the United States. Equine therapy is open to individuals of all backgrounds, as well as those with varying degrees of experience with riding on horses. You don't need to have ever been around a horse to participate in equine therapy. They actually encourage those who have never experienced it before to try it, because it is something that they can use as a new coping skill, and by mastering this new skill they will have more confidence and more self-motivation. Equine therapy has also been shown to increase an individual's metabolism, which is due to the physical benefits of riding. Hippotherapy is used as a form of treatment and rehabilitation for many individuals. It is used as a treatment for mental, physical, and psychological problems such as cerebral palsy, multiple sclerosis, ADHD, Parkinson's, autism, schizophrenia, at-risk children, and PTSD victims, among many others. Hippotherapy is a popular form of treatment among those who are affected with cerebral palsy. The cerebral palsy is a congenital disorder that causes poor coordination and poor movement, as well as causing weak motor skills in the affected individual. Those with cerebral palsy have noticed an improvement in their muscle symmetry through the participation of hippotherapy. This is due largely to the fact that through equine therapy, the riders are able to experience a third plane while on the horse, and because of this, they are provided a more stable sense of balance. A study done on children with cerebral palsy who participated in an 8-week hippotherapy program found that they experienced an improved sense of gross motor function, as well as walking. Another study showed that a 7-week hippotherapy program with developmentally delayed children still showed their improvements 7 weeks later after the treatment. Hippotherapy is also a greatly used form of treatment by those affected with multiple sclerosis. Multiple sclerosis is a neurological disorder that affects an individual's visual, somatosensory, and vestibular systems. Those who are affected with this condition experience poor mobility, stability, and balance. Treatment is primarily focused on improving a patient's stability, and they do this by assisting the body in aligning in a more natural state to help regain the center of balance. In a 7-week study with those with multiple sclerosis, it was found that they did have an improvement in balance. Individuals who are post-stroke also find hippotherapy to be a very useful tool for recovery and rehabilitation. After a stroke, an individual's mobility and gait is severely damaged. In one study, individuals who had experienced a stroke underwent hippotherapy, and after a period of 16 weeks, they experienced a significant improvement in their motor abilities as well as their gait. The diagram shows how the posture on a horse is affected as well as their mobility of movement. The arrows show that the spine is straightened as well as their hips are aligned, and this is due largely because they are on the horse and they are experiencing that third plane, so this enables them to find their sense of balance. Those as well as more responsive. Those with Alzheimer's and Parkinson's also find relief with the use of hippotherapy. A study performed with 96 subjects with either Alzheimer's or Parkinson's revealed that their hippotherapy sessions helped improve their gait, stability, as well as their motor function. More longitudinal research will help determine the long-term effect. The diagram shows pelvic motion while riding a horse. The horse provides, again, a third-dimensional plane, which allows the sensory input to be transferred to the brain and the nervous system, making the body more in tune with itself. Those with schizophrenia are also known to be greatly involved with therapeutic horse riding. A study with 6 individuals with schizophrenia that underwent 10 weeks of therapeutic horse riding showed great improvement. They all experienced a bond with their horse and had fun, as well as they built relationships with one another. And the staff realized that they could be trusted to complete the exercises more than they had previously thought at the beginning of the therapy sessions. More research in this area will benefit in showing the long-term effects of this research. Those with autism are also known to participate in hippotherapy for the experiences and benefits. Autism itself is a complicated disorder that is still trying to be fully understood. Hippotherapy may increase self-motivation and self-efficacy for those with autism. It is difficult to determine and measure the results in those affected by autism. More research regarding autism and autism with hippotherapy is needed to be more conclusive. The picture above shows a girl with autism in a hippotherapy session. She is doing what is called side walking, where she leads her horse through a lead rope, which is pictured there. Right now she is working on her muscle tone, mobility, and balance while having fun and improving her self-confidence and self-motivation. Individuals with ADHD also experienced the benefits with hippotherapy. After an 8-week treatment of hippotherapy, children with ADHD showed positive results in their motor skills as well as their social skills. These results may be due to the fact that they work with the horses one-on-one and that the horses have a calming effect on the children. After working one-on-one with these horses, the children begin to use that as a coping skill and are able to calm themselves in future situations and scenarios. The image above shows the difference between a normal brain and one with ADHD. The brain with ADHD is seen to have low neurofeedback, which means that the neural pathways are lethargic, which causes a person's mind to become scattered and foggy, hence the attention deficit. Hippotherapy has become a very popular and widespread form of rehabilitation and coping skill with the veteran and PTSD community. An estimated 31% of veterans experience PTSD. 10% of these veterans are from the Gulf War, and 11% are from the war in Afghanistan. Approximately 24% of veterans come back from Iraq or Afghanistan with severe trauma of some sort. Through therapeutic horse riding, veterans have been able to experience positive changes in their daily life and health, as well as building healthy relationships with themselves as well as others. Many hippotherapy facilities provide hippotherapy free of charge to veterans, and they have programs designed specifically towards the veteran and PTSD community. Hippotherapy is very useful to veterans who have lost limbs because it increases the core strength of their lower back. Children are a very big population of the hippotherapy community, and most hippotherapy facilities, most of their programs are built for children with disabilities or just as a therapeutic riding session. At-risk children are children that are less likely to transition successfully into adulthood and become successful because of disadvantages that they are facing. This may be socially, economically, or even physically and emotionally. The chances of them becoming successful and well-rounded adults are slim. Research has shown that these children that participate in therapeutic horse riding have positive and significant changes in self-control, trust of themselves and others, as well as an improvement of their own self-image. Children who experience intra-family violence also benefit from therapeutic horse riding. The picture above shows a child with a brain injury undergoing a hippotherapy session. And as you can see, he is having a lot of fun. A 12-week study with at-risk children showed that after they went through equine therapy, there was an increase in their positive behaviors, such as positive communication, respecting others, and healthy social skills. They also experienced a decrease in their negative behaviors, such as isolation from others, poor social and communication skills, as well as their self-harming. A study conducted over 18 months with children who experienced intra-family violence showed an increase in the Children's Global Assessment of Functioning Scale. The Children's Global Assessment Scale is a numeric scale that rates children from 1 to 100. And it is used by mental health clinicians to rate the general functioning of any child under the age of 18. What this means is that the higher they rate the child, the better they are at functioning in all areas of life, such as home, school, work, as well as socially. The end results were that these children were improving their mental as well as their psychological health, as well as their quality of life through the help of therapeutic horse riding. In conclusion, hippotherapy and therapeutic horse riding show promising results in regards to physical and mental disabilities, as well as the overall improvement of daily life. Current research shows positive and significant changes in balance, mobility, gait, and posture with those affected by physical disabilities. Mentally, the current research shows that hippotherapy provides individuals with a greater self-esteem, confidence, self-worth, and motivation. More research is needed to come to a firmer conclusion regarding hippotherapy and its long-term effects. This concludes my presentation on hippotherapy, and I hope that you were able to learn something new. Thank you for watching.